Next up is Dr. Faraz Vahid Shahidi to discuss job stressors and burnout. He's also very quick on the keyboard. Thank you, putting links in the chat for us all to get more information. Faraz is an associate scientist at the Institute for Work and Health and an assistant professor in the Dalla Lana School of Public Health at the University of Toronto. A social epidemiologist by training, his research examines the social and economic determinants of population health with a focus on the role that societal conditions play in shaping the health and the safety of working people. So over to you, Faraz.
Thank you. So I was very generously invited to today's webinar to present to you some work that was recently conducted by myself, a couple of colleagues at the Institute for Work and Health, and John Ojic from the Occupational Health Clinics for Ontario Workers. The topic is on sort of the potentially dynamic and reciprocal role, relationship between job stress and burnout. So I'm going to work through a little bit of some results from a paper, talk a little bit about some key messages on this idea of, we know there's a relationship between job stress and burnout, but sort of to delve into some nuances around, at least in the Canadian working population, what the causal nature and causal underpinnings of that relationship are, and what direction or directions potentially that relationship runs in. So just to acknowledge the research team I mentioned, this project was actually sort of developed, and the survey was designed by John Ojic and others at the Occupational Health Clinics for Ontario Workers in collaboration with Institute for Work and Health scientists, including Peter Smith and Monique Gignac. I had an opportunity as part of my postdoctoral fellowship at the Institute for Work and Health to work with some of this data that OCAL collected. And I'll hopefully remember to give you a sense on the slide as to why this data that OCAL collected was so novel and so interesting and provided a really unique opportunity for people like myself who are interested in the relationship between job stress and mental health. Also, just to acknowledge our funding sources again, OCAL and also the Canadian Institutes of Health Research. So just a little bit of background. We know, hopefully all of us today know, that psychosocial job stressors, think high job demands, low job control, a lot of the factors that, for example, Juan was talking about just a few moments ago. We know that these job stressors are associated with a very sort of diverse range of adverse mental health outcomes. Just to name a few, higher rates of burnout, depression, anxiety, and suicide. For decades, researchers have really sought to determine whether the relationship between these psychosocial working conditions and mental health is a causal one. And by now we have a broad suite of really well-designed longitudinal studies that tell us that is indeed the case. We really have an increasing degree of confidence that the relationship between job stress and burnout is indeed a causal one, which likely doesn't come as a surprise to many of us in the call today. But recently, where attention has turned is towards exploring the possibility of a dynamic or reciprocal interplay, so back and forth or bi-directional interplay between the psychosocial work environment and mental health. The idea here being that we know that work can affect mental health, and we're increasingly wondering in the field, particularly in the field of occupational health psychology and sort of those of us working on psychosocial risk factors at work, whether mental health might also in turn affect work, and in particular, those aspects of work that we tend to find very stressful and that then tend to feed back into our mental health. So prevailing job stress models that many of us are going to be familiar with, think the demand control model, the effort reward imbalance model, the organizational justice model, these sort of conventional job stress models do what we probably think is very reasonable and emphasize the role that psychosocial work conditions play in the development and maintenance of mental health problems, what we might call, and what I'll call today, forward causation from work and the work environment feeding into our mental health. But there are also really important theoretical and conceptual reasons to believe that causal relations might also run in the other direction, what I'll call, and what many others call, reverse causation. That is, the impact that poor mental health status can have on our experiences of psychosocial working conditions, both sort of objectively with respect to the quality of sort of psychosocial life at work, and also with respect to our perceptions of what's going on at work, which we know matter. Poor perceptions at work we know matter for our health status, including our mental health status. And this idea that mental health can feed back into our experiences at work, in the labor market, and so on is not new. Just by way of an example, some work by Dr. Kathleen Dobson and other colleagues at the Institute for Work and Health looking at the impact of a major depressive episode in Canada on earnings trajectories over 10 years of follow-up. And what Dr. Dobson does in this study is sort of show us really compelling evidence that among Canadians who experience a major depressive episode, the cumulative impact of that depressive episode, all other things being equal, a really well-designed, well-controlled study, all other things being equal, an experience of a major depressive episode among Canadian workers has a cumulative impact amounting to about $70,000 over a 10-year period among women, and about $115,000 cumulatively among men. So really significant impact on work experience. So again, just to give you a sense that it's really intuitive and increasingly documented that our experiences of mental health, like a major depressive episode, can have a really significant impact on our experiences at work and in the labor market more broadly. And there are a couple of reasons we think this relationship runs in the reverse direction as well, runs in the direction from mental health status towards work. And there are two prominent hypotheses in particular. The first is known as the drift hypothesis. And what this hypothesis states is that individuals with mental health problems might experience a sort of downward pressure into lower quality jobs that are, by virtue of their lower quality, characterized by a sort of stressful work environment. And there could be a few pathways or mechanisms underlying this sort of drift process. It could be, and we have documented, that persons with mental health issues encounter these sorts of structural barriers in the labor market, but also once they obtain employment, other sort of barriers, including stigma and discrimination within their workplaces. And that can include things like differential and unfair treatment in the workplace that has an effect on, of course, their experiences and perceptions and so on at work, in the workplace. It could also be that persons with mental health issues are actually opting out of work entirely. And the reason for that could be that we know that work is one of the leading causes of stress in our lives. And if you're already struggling, for example, with a mental health problem, it may actually be a very reasonable decision for you to opt out of sort of career advancement or employment altogether, because it could pose a potential further harm to your mental health. Another way of thinking about this is also, if you are mentally and physically exhausted, it might sort of inhibit meaningful, respectful, joyful relationships at work. And this in turn could produce an experience at work that's very stressful, and that you're simply not happy with, and so on. The second hypothesis we call the gloomy perception hypothesis, and it states that mental health issues can cloud or influence or color our perceptions of the work environment, such that even when all things are equal, individuals living with mental health problems might report more stressful working conditions than their healthier counterparts. So two workers who are situated in the same work environment, all things being equal, a person struggling with mental health issues might perceive that work environment a little bit differently. And the idea here isn't that this is imaginary, all imagined in people's head, that it has no basis in reality. Actually, what we're finding is that even this experience of perceiving adversity in your work environment can feed back into objective, very real aspects of work. So the perception can, in turn, have a very real material impact on the work environment, and we can see the consequences of that. So in this sort of presentation and in the paper, we sort of narrowed in on one aspect of mental health, and that's burnout. So very broadly, just I'll describe a little bit better later, but think of burnout as extreme physical and mental exhaustion. So it's a little bit like tired, it's a little bit like stressed, but ultimately this is something a little downstream. And many people characterize it as sort of extreme physical and mental exhaustion. And in the process of doing some of this work, we came across this study by Guthrie Dorman and colleagues, where they sort of do a systematic review and meta-analysis of 48 really well-designed longitudinal studies, looking at the relationship and directions underlying the relationship between job stressors and burnout. And they sort of conclude, yes, these 48 studies, really well-designed longitudinal studies, seem to be telling us that there is a mutually reinforcing relationship between job stress and burnout. But interestingly, they tell us the effect of job stress on burnout in the forward direction appears to be, they say, much smaller than the effect they sort of measure from burnout back to job stress in the reverse direction. They describe this as a really surprising finding, and it's likely piquing your curiosity as much as it was piquing ours as we were going through this work. And it made us want to explore this question in the Canadian context, which we haven't had an opportunity to do. But just to sort of drive point the sort of surprising, I would say sort of perplexing nature, here's an article from Forbes that reported on this paper, saying the results of the new study challenge the common assumption that work stress is the driving force behind burnout. Findings from this new study show that work stress and burnout are mutually reinforcing. However, contrary to popular belief, burnout has a much greater impact on work stress than vice versa. And this is a lot more than just an academic question. Is it job stress leading to burnout, or is it burnout leading to job stress? Academics, scientists, we can pontificate about this, we can test this, we can study this as much as we want, but it's a lot more than just an academic question. Because in broader discourse, in broader social policy, in broader organizational practice, in broader sort of clinical practice and occupational practice, we're seeing heightened interest in things like wellness, resilience, mindfulness, these sort of individual level wellness-based programs as really key tools for helping workers manage the symptoms of stress, cope with burnout, as a way of preventing it from feeding back into their working lives. Personally, I'm really critical of this sort of approach. I think it's really expedient. I think it's easy. I think it kind of avoids decades of research telling us that fundamentally what's going on in people's lives is that the workplaces and the sort of work that they're engaged in are feeding into their mental health. But this is sort of the backdrop to our study, that you have this large, well-cited systematic review meta-analysis coming in and saying it appears that the effects of job stress on burnout are much smaller, they say, than burnout on stress. And this sort of result is unfolding in a background societal context where employers, government, so on, are really interested in the behaviors and sort of individual level actions that workers can take to interrupt this cycle, this negative cycle and spiral between stress and burnout at work. So we came in with a few study questions. Is there, in fact, a bidirectional relationship between psychosocial job stressors and burnout in the working population of Canada? Assuming that relationship is bidirectional, what direction is stronger than the other, or are they equally strong? Is the forward relationship stronger or the reverse relationship stronger? And are the job stressors implicated in the forward direction of that relationship the same as those that are implicated in the reverse direction? And the way we went about doing this is actually by using some data that OCAL, in collaboration with the Institute for Work and Health, collected back in 2016, and then again in 2019, using an online survey administered to a national panel of about 100,000 volunteer respondents, curated by Ecos Research Associates, a market research firm. In order to be eligible to participate in this online survey, respondents had to be at least 18 years of age. They had to be working at an organization with 5 or more employees. They had to be comfortable completing our questionnaire in English or French. Just to give you a little sense of sort of where we got these volunteer respondents from, I mentioned it's a national panel. It's broadly representative of the Canadian population, and I'll get back to this briefly. And we achieved a response rate of about 12%, which is sort of on the reasonable end, but also on the lower end of the sort of response rates we see when we use these convenience-based volunteer samples panels. So we collected, I wasn't around, so I shouldn't say we, but John and others at the Occupational Health Clinics for Ontario Workers collected in 2016 a sample of about 3,500 individuals. They went back to that panel about 3 years later in 2019 and collected responses from about another somewhere between 3,000 and 3,500 respondents. And what was interesting is that from the 2019 sample cycle, we were able to identify 636 responses that linked back to the 2016 cycle. And what we ended up with was an opportunity to follow the same 636 workers in Canada over 2 time points about 3 years apart. So a sort of longitudinal data opportunity embedded within what otherwise was a really sort of cross-sectional, repeated cross-sectional setup. And it's those 636 persons that I'm going to really narrow in on for this, for the analyses, for this paper and for the analyses I'm going to be presenting. Just to tell you a little bit about what we measured. So like Juan and many others, we adapted our questions from standardized items in the Copenhagen Psychosocial Questionnaire, the COPSOC, a widely validated tool for the assessment of psychosocial risk factors at work. We grouped 31 items from the COPSOC, which were sort of designed to measure 15 dimensions of the psychosocial work environment, into 6 overarching job stressors. So these were our sort of key work stressors: job demands, job control, coworker support, supervisor support, organizational justice, and job insecurity. And if you have any questions about what these individual dimensions or job stressors we're measuring, I'd be happy to talk about that in the Q&A. We measured burnouts using the Copenhagen Burnout Inventory, which is designed to capture general symptoms of exhaustion and fatigue in the working population. Questions like, do you feel worn out, emotionally exhausted, physically exhausted, and tired? All the results I'm going to be presenting today are statistically adjusted for the following characteristics, just to rule out competing explanations: age, gender, region, education, full-time versus part-time versus casual employment status, whether or not persons are in managerial positions, regular, irregular, atypical, rotating shifts, your industry, and your firm size. For analyses, we used what we call two-wave cross-linked panel models. And what these models enable us to do is to examine bidirectional associations between, say, an exposure of interest like job stressors and an outcome of interest like burnout. And how we did that was, as I mentioned, by exploiting the longitudinal structure of the data that sort of organically appeared in the process of the repeated administration of the same survey to this same national panel of workers in Canada. And what it does is allow us to control for the baseline values of these constructs. And this just lends us, this longitudinal sort of opportunity lends us greater confidence when we make certain conclusions about the relationship between exposures and outcomes. So just to give some more meaning to what these cross-linked panel models do, what they do is sort of say controlling for X and Y at baseline. Does X at time 1 predict Y at time 2? And counter to that, does Y at time 1 predict X at time 2? And this allows us to sort of test the relationship between job stresses and burnout in both of those directions, and also quantitatively adjudicate between the forward and the reverse directions. So our hypotheses before moving into results. So there's a possibility where, at baseline, job stressors don't affect burnout, and at baseline, burnout does not affect job stressors. We call this the stability or null model, no longitudinal associations. There's an intuitive forward causality model where at baseline, job stressors you report in 2016 affect burnout in 2019. The reverse might also be true, where burnout in 2016 affects job stressors in 2019. And there's the possibility of reciprocal causality, that both of those things are true. Both directions are operating, that job stressors are impacting burnout and that burnout is also impacting your experiences of job stressors. So after removing some sort of some observations with missing data that we couldn't include in the analysis, we ended up with a panel of 453 individuals that we followed up fully with between 2016 and 2019. Just to give you a sense of a couple of key variables here, we noticed that the sample was a little bit older than what the labor force survey tells us about the actual sort of population of workers in Canada. Also, the distribution of gender leaning more towards women than, again, what we would know from the labor force survey, which is telling us that the working population in Canada actually leans more towards men. And finally, what we found was we ended up with a sample of very highly educated persons. And this is probably a function of the voluntary nature of this survey and who's sort of participating in these voluntary panels. But in the labor force survey, we find that about 30 to 35% of workers report having a university degree, whereas it was about almost twice that, about 60%, almost 60% in our sample. Moving into the results, so with respect to the stability hypothesis, and as a reminder, this is a hypothesis telling us that we're not going to observe any longitudinal associations between job stressors and burnout. Where we sort of saw this hypothesis play out is with respect to coworker support. So coworker support did not appear to have a lagged association with burnout, and similarly, burnout did not appear to have any sort of lagged association with coworker support. Moving on to our next hypothesis, we found support for forward causality quite consistently and quite strongly across a number of the job stressors. So we found that higher job demands, lower job control, higher job insecurity, and lower organizational justice at time 1 predicted higher burnout at time 2. So this is the sort of conventional results we'll see in a lot of these studies. Having higher demands, having lower control, and so on, even controlling for sort of all sorts of baseline characteristics, including your baseline burnout levels, is over time, over a 3-year period in our case, going to be associated with an increase in burnout symptoms. With respect to reverse causality, we saw a little bit of support, but a lot less. Much more limited support for the reverse causation hypothesis. What we found is that higher burnout at time 1 was only associated with a change in supervisor support, in particular, a decrease in supervisor support at time 2. Interestingly, we did not observe any bidirectional associations between burnout and any single dimension of the psychosocial work environment. So for any single job stressor, the association ran in either the forward or the reverse direction, but it never ran in both directions. Or to put it a little differently, the job factors that we know, or that we found at least, are involved in the forward direction from job stressor to burnout appear to be different from those factors involved in the reverse direction from burnout to stress. And we thought that was an interesting observation as well. And I won't return to this later, but just to tell you why, a little bit why that's interesting is because we often tend to study these stressors independently of the other. So we'll have a study on job demands, or we'll have a study on supervisor support and social support in the workplace, or we'll have a study on job insecurity. And what this finding, that the factors involved in these directions are not necessarily or always the same, what this finding tells us is that when we adopt that sort of truncated or isolated view of a given job stressor or another, we might not actually get a sense of how holistically, in general, causal relationships are running between this broader construct of the psychosocial work environment and psychosocial risk factors at work and mental health. To quickly summarize, taken together, our results provide what I would characterize, and I think what we've characterized, as only limited support for the notion of a bidirectional reciprocal relationship between the psychosocial work environment and burnout, at least in the general working population of Canada. On balance, our findings suggest that the psychosocial work environment is causally predominant, such that it is much more appropriate, we think, to understand stress at work as a cause of burnout, rather than the other way around, as a consequence of burnout. And this is very much consistent with prevailing job stress theories, which do emphasize the role that adverse psychosocial working conditions play in the development and maintenance of health problems. Just a couple more minutes to share some limitations and what I think are the key messages for us to take away from a study like this. It would have been great to delve into some complexities, nuances with respect to these causal pathways, but in order to do so, we would need a lot more waves of data. We only had 2. We would need a lot more waves of data, and unfortunately, data of this nature is simply not collected in Canada, which is, again, why the data that OCAL collected presented such a special and unique opportunity for those of us working in this field and interested in the psychosocial work environment in Canada. But until Statistics Canada and other actors start collecting this data more routinely, more comprehensively, we just don't have the opportunity to do the sort of more robust and more complex sort of work. We also didn't collect information on some key demographic and socioeconomic characteristics that we otherwise would have loved to statistically control for, things like income, race, and immigration status. And there was also a high rate of non-response for the survey. As you'll recall, about 89% of respondents did not accept our invitation to participate. And this does raise concerns about the representativeness of the sample. I talked, for example, about how the sample was older, more female, and also much more highly educated than what we know about the true population of workers through something like the labor force survey in Canada. And just to wrap things up with a couple of key messages. So a little bit of a slogan here. We think it's not you. We think it's the job. And again, for those of us attending today, I think this is going to be very intuitive. But in light of both what recent meta-analyses are concluding and that are getting picked up by things like Forbes magazine, and also in light of this really growing interest in our society and in our workplaces, in the sort of actions and behaviors that individuals can take to manage their mental health, to sort of have a positive then influence on their working lives, it bears sort of it's useful, I think, to repeat that the sort of takeaway for us is, at least in this sample, it appears to not be you, it appears to be the job. So job stress, we think, is still the driving force behind burnout in the general working population, rather than the other way around. And the broader implication here, particularly in light of this growing attention to sort of secondary screening and tertiary interventions that involve sort of individual level wellness-based initiatives, promoting mindfulness, building resilient workers, and so on. The implication, rather, from our study is that if we want to prevent a downward spiral between job stress and burnout, then interventions should focus upstream. They should focus on improving what we know fundamentally is at play here, which is sort of unhealthy, harmful, stressful work environments. And those interventions cannot and should not merely focus on instructing workers how to cope with burnout and better manage the symptoms of stress. Because what these interventions, what these secondary and tertiary interventions do is sort of send workers right back into those work environments that produces the stress and that produces the burnout symptoms in the first place. These interventions also do nothing to prevent entirely new cohorts and generations of workers from entering a labor market characterized by sort of increasingly high levels of job stress, job insecurity, and so on. So really the focus, we think, needs to sort of swim back upstream towards sort of what we think are the fundamental drivers and sources of this sort of downward spiral and feedback loop, which is the work environment, improving the work environment. And I think that's it for me. So some contact information. Thank you. Yeah, sorry, go ahead.
Faraz, thank you so much. I mean, this was so needed, this work. I hope all of the authors of all those meta-analyses read this work. I mean, you know, inherently we know that a lot of interventions are to help and support individuals, and they are important, but that what's not getting done a lot of times is the organization looking at what factors it can change to help with that process. So this is very important work. Thanks so much. Okay, we have a few minutes for questions and discussions on Faraz's presentation. I have Denise. Denise, you have your hand up. You go ahead.
No, I was just saying thank you. It was a clapping hand. So thank you very much for the presentation. Okay. Yeah.
I see John put the link in the box about the journal article. Okay, it's your time. Ask any questions, put up your hands, any comments, thoughts. Does this resonate with people? Scott, you have your hand up.
There we go. Hi, Terry. Thanks very much. Hope your retirement's going well. Faraz, I'm coming in a bit late there, another meeting. What I found within probation and parole community corrections, if you look at survey results and in speaking with my colleagues on the youth side, there's a couple of major primary differences, even though the job is primarily the same. Certainly it's the same class code. Their caseload numbers of clients are significantly less than ours. So one could say that they have greater staffing resource levels than adult probation and parole. They also have significantly lower workload. To what degree, and they have better job satisfaction, yada, yada, right? They don't have the level of non-physical mental health sort of ailments that we do. How much did you find that burnout or whatever is associated with staffing resources and sort of the workload demands?
Yeah, so for me, there are actually two parts to my answer. And the first part allows me to get at what I think is an important point in light of the meta-analyses I talked about, the systematic review, and why we think we might have found some different results. So the interesting thing about the meta-analysis, and I promise this, we'll get back to your question. The interesting thing about the meta-analysis is that of the 48 studies they reviewed, an overwhelming majority focused on specific occupations. And I still went over time, but I couldn't make space to note on a couple of important things in that regard, and somehow still went over time. But that in our study, we really firmly believe that we should be drawing a sample from a general working population and not a specific occupation. So of the 48 studies, the vast majority focused on healthcare professionals and teachers. And we think one of the things that might be going on is that there might be specific nuances with respect to the causal sort of dynamics at play here between job stress and burnout that are specific, that are unique to specific specific professions, occupations, and that those specificities might not bear out in a general working population, like the one that we used in our study. So to get to your question, I hesitate to answer, in part because I think one of the important dynamics at play in our study, as opposed to a vast majority of other studies previously conducted feeding into things like the meta-analysis, did not look at a specific occupation. And your insights you might have within a specific occupational context might actually be, at least with respect to that occupational context, much more valuable than anything we're going to be able to tell you in a sample of sort of 450 general, a general working sample in Canada. But, specific to your question around the staffing, resources available, pacing, we generally did not see a feedback back from burnout into things like quantitative demands, pressures at work, and so on. We really only saw the classic conventional forward effects from things like demands and pacing and staffing and so on into experiences and self-reports of burnout. Sorry, that was a very long answer.
Great, thanks very much. Just from a layman's perspective, one not reasonably assume that if it's the same, similar, mirrored job between two different ministries, you would expect to see more of a correlation in job satisfaction, all of the sort of measurables, and we're seeing just the opposite. We're seeing that on the youth side, where they don't have as great a workload demand because they've got larger staffing resources, much more job satisfaction, less anxiety, depression, all the measurables in our various surveys. So it's something that we're trying to sort of weed out and figure out whether we need more staffing resources or, better coping mechanisms, what have you. All right. Thanks very much.
No, my pleasure.
Thanks so much, Scott. And I think, in the next presentation, we are going to hear from the corrections sector and see what road that you've been on for the past like 10 years on this. It's very inspiring work you've been doing. Any other questions or comments for Firas? Do check. Oh, Val, you go ahead.
Sarah has her hand up and so does John, so I don't want to.
Okay, sorry, I didn't see their hands. Thanks for telling me. So John and then Sarah.
Yeah, Firas, I was wondering what the implications of your findings are for supervisors who have workers that they know are burning out.
That was my question, John. Too, as a supervisor and having a supervisor, what ought we to think about in both directions?
Right. So we had a couple of hypotheses about what might be going on with respect to supervisor support and the sort of unique position it seemed to hold in our results, unlike the job demands, job control, organizational justice, and job insecurity. We thought, in accordance with something like largely with the drift hypothesis, is that it could be that, and maybe this is the intuition you share as well, John, Valerie, that supervisors may not be responding to and accommodating the needs of workers who are presenting at work with burnout. What supervisors should do in that regard feels a little bit outside of my wheelhouse, personally, but I know that we have a lot of expertise, complementary expertise in the room today, and I know that there's an intention of having some sort of discussion specific about this question as well at the end of today's event. So for now, I think I'll just say that we do think this is fundamentally about how supervisors are trained and so on to respond to and meet the needs of workers who are presenting at work with burnout, but what supervisors should do about it feels a little outside my wheelhouse, unfortunately.
Okay, thank you.
Thank you, John.
Okay, let's go to Sarah.
Sorry, Terry, I was just posting stuff in the chat. I don't have any comments.
Okay, yep. Yeah, I was going to say, everybody, make sure you check out the chat. You can open up the chat box. There's lots of useful links and things to the research the speakers are talking about throughout. And Sarah posted some plain language summaries because the Institute for Work and Health has a great list, and they do plain language summaries of all the research, which is excellent.
Ask
Thanks.
one more question, Terry?
Sure. Yeah.
Well,
One more
actually,
question.
It's a question for John, I guess. Is there enough data in the pandemic experience surveys that would allow another look at this? It's only a year later and it's amidst the pandemic, I guess, in 20 and 21. Do we have answers to the questions that would allow an extension of this work?
Well, the pandemic surveys were designed so that people could fill them out over and over again. However, very, very few people did. So we don't really have enough repeat responses to be able to do an analysis, unfortunately.
Okay, thanks.
Okay, well, thank you so much, Firas. That was excellent. I'd heard about this work, but hearing the presentation actually made it more crystal clear in my mind that, attending to not just support to the individual, but organizational factors is key if any place wants to make a change. And since we don't have the mandatoriness of Chile over here, right now it's a lot of leading employers that are doing that. And, others, it doesn't surprise me that you had a lack of uptake in organizations to do this.